Today, as we give an update on COVID-19, on not only cases but also vaccinations. As you are aware, on Tuesday, I gave our State of the State address and announced that Mississippi had delivered 200,000 vaccines. That's total number of shots. Today, perhaps even as we speak, the 200,000th Mississippian will get their first shot. We've been smashing roadblocks and getting more and more vaccines out to the people who need them. It's been quite a journey, and there's a lot more left to be done. But I'm incredibly proud of the heroic effort of the team that got this effort turned around. There's one person that I've been able to constantly lean on for exceptional work. When he says he's going to do something, you know it's going to happen. And you know it's going to get done right. He doesn't traffic in excuses, he deals in results. And he's made a tremendous difference in this past year of what seems like constant emergencies. That one person is Greg Michelle, who has served as the director of the Mississippi Emergency Management Agency throughout my term, as well as a couple years before. Quite a few months ago, Greg and I talked about things, and he said that he was ready to retire. After the year he's had, I certainly can't question that. We've been working since then to put together a plan and to make sure that the transition is done right. I got to tell you, we're all sorry to see him move on, but we're incredibly grateful for his service. Incredibly grateful that he's made the transition as smooth as it possibly can be. He has a great successor, someone who has unquestionable credentials and my total confidence. Those of you who watch these press conferences regularly will recognize Lieutenant Colonel Stephen McCraney, or Mac, as he is known to those of us who have spent way too much time together in the last several years. Today, Mac serves as the Deputy Director for the Mississippi Emergency Management Agency, and he's been serving there since 2016. His experience is not just limited to the top roles he's had at MEMA, he's also had boots on the ground. During his 28 years as Lieutenant Colonel in the Mississippi Army and Air National Guard, he responded to Hurricane Katrina, the Smithville tornado, the Deepwater Horizon oil spill, and the Mississippi River flooding of 2011. He's a former commander of the 47th Civil Support Team, Community Corrections Associate Director for Probation and Parole, and a certified police officer. Since 1985, he's been a public servant and a first responder. Throughout the last year of crisis, he's been right there in the room where it all happens. I know he's going to be able to provide the leadership we need at this key agency at this key moment to stay in the fight and operate at peak performance. I'm going to turn it over to both Greg and Mac in just a second, but first I want to read and sign a proclamation to honor Director Michelle for his exceptional service. A proclamation. Whereas the state of Mississippi is in a constant state of preparedness to man-made and natural disasters, Executive Director of the Mississippi Emergency Management Agency, Colonel Gregory S. Michelle, has valiantly and selflessly served the state of Mississippi with unwavering commitment to the citizens of this great state, especially during times of our greatest need. Whereas Director Michelle has served the people of Mississippi as Executive Director of MEMA since June of 2018, and under his leadership, he has guided MEMA's efforts through record-breaking tornadoes, the most active hurricane season on record, the unprecedented backwater flooding event of 2019, and the worldwide COVID-19 pandemic. Whereas during his tenure, Director Michelle has worked 21 federally declared disasters, 11 of which occurred in 2020 alone, and has led MEMA and the state's response through most federally declared disasters to occur in any one year. Director Michelle has successfully led the logistical distribution of PPE during COVID-19 pandemic, and through his tireless efforts and outstanding leadership, all 82 counties and the Mississippi Band of Choctaw Indians, hospitals, and long-term care facilities received invaluable equipment to respond to this pandemic. Whereas Director Michelle led the effort in securing a stockpile of PPE to protect the citizens during the pandemic and established the state's first ever emergency logistical center. Whereas Executive Director of MEMA, Director Michelle, oversaw the administration of approximately $250 million of CARES Act and COVID-19 payments. Whereas Director Michelle is retiring from his service to the state of Mississippi as of February 1, 2021, and throughout his service to the state, he has demonstrated his proven dedication to selflessly serving the citizens of Mississippi. Now, therefore, I, Tate Reeves, as Governor of the state of Mississippi, on behalf of the citizens of our great state, do hereby commend Director Michelle for his loyal and dedicated service to the state of Mississippi and its citizens as Executive Director of MEMA, and encourage my fellow Mississippians to join me in expressing our gratitude to Director Michelle for his tireless and dedicated service to our state. Greg, thank you for your service. Job well done. We hate to lose you, but we know that you have trained not only Mac, but a great number of people at your agency, and they're going to step in and they're going to continue your legacy. Here's the order that I have signed, and I will start by opening it up to you.
Thank you, Governor. Governor, I just want to, first of all, just tell you thank you very much for the opportunity to serve, continue to serve in this capacity. As most people know, when governors make their transition, they typically will put their own team together. In this particular case, Governor Reeves entrusted upon me to stay on and work, and it's been a privilege and honor. I will tell you that this has been the most challenging job that I've had after 30 years in the military and time in the private sector. This job has been the most challenging. I have learned a lot about myself, and I've certainly learned a lot about this state. And the biggest thing that rings true is this state comes together in bad times, and I'm very honored to have served the state, not only in the position, but particularly in this last year, in what is proven to be one of the most historical, some of the most historical events that we've seen. So I'm very humbled and honored to have served. I want to thank the citizens of Mississippi for their support in almost in every endeavor that we've dealt with, and I'm just very humbled and thankful to have had the time to serve here. I am being replaced by a very capable gentleman. Mac has been the best deputy that I could have asked for in a job like this. It's very important that you surround yourself with people that are loyal and support you and are smarter than you are, and this is the case with Mac. So Mac, congratulations.
Thank you, sir.
Get tangled up in the cord here. Thank you, Governor.
Thank you. Mac, I'm going to turn it over to you, sir.
Thank you, Governor Reeves. I just want to say that I'm humbled by your choice to allow me to lead this agency. The bar has been set high by my predecessor. He has a big set of shoes to fill, but there's only one way to do that, and that's through the staff and the personnel at MEMA. They are top-notch. They are number one, and they continue to impress me every day to do the things that we ask them to do, and even the things we don't ask them to do. They step out and make it happen. To our partner agencies, the Department of Health, Mississippi National Guard, and other state agencies that through this COVID event, we briefed on it many, many times sitting here at the table. It is a true partnership. I sat in on 2 meetings today with the Department of Health as we plan vaccinations and the distribution and the logistics chain and the National Guard members that do that. MEMA does not do this alone. And I can't thank those state agencies enough. The last group that I would like to send out my appreciation to, since I've been here since 2016 and actually met a lot of these individuals during Katrina when I originally responded with the Mississippi National Guard during that response, and that's the 82 county EMA directors and the emergency manager at the Mississippi Band of Choctaw Indians. That is ground zero. and to work with those men and women, those individuals, and what they do for the constituency of the state of Mississippi each and every day is paramount. And sir, we're going to continue to be prepared, prepare them and others to do our job, which is prepare, respond, and recover from every disaster. And that's exactly what this state does. I wouldn't want to work any other place. Born and raised here, deployed out and came back. And Mississippi is my home. And as my mother said this morning on the phone when I told her there would be an announcement today, she said, well, that's good because I got my first shot at the facility 2 days ago, and I'm looking forward to my second. So Department of Health, we have a chore to do, and that's to make sure she gets her second inoculations. But she's been patient, and I thank her for her leadership and what she's done in my life as well. And thanks for the high bar, Greg. It's something we'll do. And thank you, Governor, for your faith and trust in me.
Thank you, Mac, and again, thank you, Greg, for all that you've done. And we do all have big shoes to fill, but I'm confident that we will be able to do so. Speaking of that second dose that we need to get for your mom, either in 21 days or 28 days, just as a reminder, if you received a first dose and it was Moderna, it's a 28-day wait to get your booster dose. If it was Pfizer, it's a 21-day wait. But the good news is, in working with Dr. Byers and Dr. Dobbs and their teams at the Department of Health, they've been very busy adding appointments to our online appointment system for our state-run sites. We, in addition to that, of course, also have a large number of partner sites that are available that are getting vaccines, not as many as they would like and not as many as we would like, but that will continue. You are now able to make second dose appointments once you get your first dose, once it is delivered. That's an incredible improvement that has been made recently. And in addition to that, we have added, just within the last 24 hours, second dose appointments for the week of February the 1st, and then also for the week of February the 8th. Now, this might just make sense to me, since I'm a little bit obsessed with the numbers, but I wanted to share some context and wanted to let everyone know why this particular week will be, in terms of overall numbers of doses delivered, will be a little bit slower than the meteoric rise that we've seen over the last 3 weeks. In effect, there are very few Mississippians at scale that are eligible for their second doses this week. That's because the first 3 weeks, the last 3 weeks of December, there were only approximately, as we've said, 20,000 Mississippians that received their first dose in the month of December. A lot of those were the Moderna vaccine, and so people are having to wait 28 days. And because of that, whereas we went from 10,000 doses the week of 12/27 to 32,578 the week of 1/15 the week of January 17, this is sort of that week in the middle in which we have caught up. And so whereas we've been able to get a large number of first doses in arms the last 2 weeks, we've sort of caught up, and there aren't a significant number of vaccines that are available in our partner locations. And so we're going to really this week be limited by our supply. The total number of shots that we can put in arms is limited by the number of first doses that we have, plus the number of people who are eligible for the second doses. Because of that, we won't continue to see a meteoric rise this week, and we'll likely have just a very slight tick back from the 62,615 that we administered last week. But next week, we will start again with a significant rise. My goal in the month of February is to have the ability to do approximately 100,000 vaccines a week. That's going to be subject to supply. We do expect a slight uptick in supply starting next week of first doses. We have, over the last 3 weeks, gotten about 37,000 per week. We are expecting to get closer to 43,000. In addition to that, we've been working with Dr. Dobbs and Dr. Byers and our long-term care facilities and partners to try to reprogram. You've heard me talk about that, reprogram some of the doses that were initially scheduled for our long-term care facilities, reprogram them so that we can put them in arms for the population at large. We're doing that because we think that there was an over-allocation there, again, a decision made by the feds, and they made it with perfectly legitimate reasoning, but as we've gotten through it, it hasn't turned out, so we think we're a little bit over-allocated there. So hopefully, all of those factors being in effect, we have an opportunity to ultimately, over the next couple of weeks, get at or near 100,000 vaccines per week. We have the capacity to do it, we believe, and we are scheduling appointments as we speak. So with that, I'm going to turn it over to Dr. Byers and let him talk a little bit about COVID in general, the numbers, as well as anything else he wants to update us on. Dr. Byers, thanks for being here as always.
Thank you, Governor, and good afternoon, everybody. So, as y'all saw today, we're reporting out 1,804 additional cases, and we are reporting out an additional 28 deaths to go along with that. Just to kind of keep the numbers in mind, you know, that is, and what we are seeing is some decline in the numbers. It hasn't been dramatic, but we are seeing some indicators that are showing over time we are plateauing and leveling off, and in some cases dropping down in the number of cases and in the number of deaths. We're looking at some other indicators that indicate that as well, like our syndromic surveillance that shows that we are seeing some declines as well in the number of cases, the number of emergency room visits for COVID-related illnesses. If you look at our hospitalizations, we have seen some improvement in the number of people who are hospitalized with confirmed COVID, the number of people who are in the ICU for COVID or are having to utilize a ventilator. Those are all improvements. But we are by no means out of the woods. We are still much higher than even the surge that we had over the summer. We're still seeing lots of cases being reported. We're still seeing a lot of deaths being reported. Just as a sobering reminder, we had almost 1,000 deaths in December, and certainly we have achieved that in January as well. We hope to see some improvement in those numbers as we see the case counts decline. Certainly the more people that we vaccinate is going to be better, but we are still a long way from achieving any sort of population immunity as of yet. Now, as the governor said, and the good news is for those individuals who have received a first dose at our drive-through clinics throughout the state, they are now able to go immediately on the website and schedule a second dose appointment. So there's no guess for them. As we've said from the very beginning, if we've got the vaccine for first doses, we are going to have the vaccine for second doses. We are having a bit more visibility in our vaccine allocations now. We hope to be able to see those with a few more weeks out so we can do some increased planning. We are working hard to not only to make sure that we have an appropriate supply of vaccine for our drive-through clinics, both first and second doses, but also to make sure that we can continue to provide some modest amount of vaccine to our external partners, our hospitals and our clinics throughout the state, who are really starting to do a good job with vaccinating the individuals in their communities. And we're going to need to continue that. As the governor said, also, you know, we have seen some increases in the number of vaccines, both first and second doses, that we're doing on a weekly basis, and we hope to continue to see that increase. Just to keep some things in context, we have vaccinated about 20% of our 65 and older population. If you look at the 75 and older population, we've vaccinated with at least one dose about 30% of that population. So we are making progress in that group. And Governor, that's all I have for today.
Thank you, Dr. Byers. As I mentioned earlier, I think I see Bishop Crudup over there. If y'all will just switch places real quick, I just wanted to give my friend, the bishop, an opportunity. He and some fellow pastors have gotten together and are talking about this upcoming Sunday, a plan to bring help, hope, and healing to those who are sick, especially COVID-19 patients and healthcare workers, through prayer. And I wanted to just raise awareness for him and his team's efforts, and wanted to turn it over to him for a minute or two.
Governor, thank you so much for the opportunity to talk about what is going to be one of the largest prayer events in the history of the state of Mississippi. It's called Healing Mississippi. It will take place this coming Sunday, January the 31st at 2:30, because, Governor, there is no football this Sunday. And so we don't have any distractions, and people can come out and pray. And we are inviting every person of faith who believes in prayer across the state of Mississippi to come out to their local hospital. The prayers will happen at every local hospital in the state of Mississippi. Governor, we're working with the Hospital Association. All the hospitals have been notified, and we're encouraging people to come out to their local hospitals so that we can pray for people who have COVID-19, for them and their families to be healed, as well as everybody else that is there at that hospital. And we will also be praying for these courageous healthcare workers who've just done, they're our heroes. They've done a tremendous job for all of us, and we know that they're tired and weary, and we want to pray for their strength, their support, their encouragement. And so we're encouraging folks to come out wherever they are to do that. Nobody has to pre-register. There is no cost for this. Just go to your local hospital, wherever it is. I've got every denomination in the state, Governor, that has said that they're supporting this. We're just encouraging people, you know, everyone. It doesn't matter what demographic you come from. We want you there this Sunday at 2:30. And we just believe that something miraculous is going to happen as we pray for folks with COVID-19 and their families and our courageous healthcare workers. Thank you for this.
Thank you, Bishop Crudup. I really do appreciate your efforts. It's www.healingmississippi.com. That's HEALING Mississippi.com to register. But you don't have to register. If you show up at your hospital, be safe in doing so. But again, we have talked a lot about a message of unity for our country, and certainly, hopefully, the vast majority of us can unify around an opportunity to pray for those healthcare heroes and pray for those who are struggling in our hospitals. And while those numbers have come down considerably over the last several weeks, we still have approximately 1,000 Mississippians throughout our hospital system that are fighting this horrible, horrible disease. And so I want to personally thank you for being here.
And Governor, if I could say, if people
Sure.
would bring their masks, we will social distance so people will be safe in what they are doing. Everything will be done outside, by the way. We will encircle the hospital, hopefully, if we get a lot of folks, and we believe we will. And so, listen, it's safe. Come out and be a part. Thank you, Governor.
Thank you, thank you, thank you, Bishop. Again, we appreciate everyone being here today, and with that, I will open the floor to questions. Dr. Byers, as he comes back. Yes, sir.
Governor Reeves, the goal is 100,000 vaccinations a week. Will the weekly allocation increase from 36,000, and what does that look like right now?
So the visibility that we have for the week of February 1 suggests that we're going to see between a 15 and 20% increase Feb 1 compared to where we were this week. For the last 3 weeks, we've been at approximately that 37,000 number. And so next week it's going to increase to approximately 43,000 first doses. And then next week we also will have approximately that many more people eligible to receive their second doses. And so as we get further along in the process, more and more people will become eligible depending upon whether or not they got the Pfizer or the Moderna vaccine. The week of February 8th, we will have probably more people eligible for second doses than we actually have first doses available. And so that 100,000 number is a goal of an ability to deliver vaccines. It is still subject to supply. And right now, certainly this week and certainly last week, our biggest mitigating factor and our biggest limiting factor has been supply of the vaccine. We do see it increasing, as I said, in the week of Feb 1, so starting on Monday to 43,000. The way the process works, we are usually alerted on Tuesday by HHS as to what our allotment's going to be, but Dr. Byers and his team can't go in and actually order it until, I believe it's Thursday night. So later tonight, they'll actually be able to order that for the upcoming week.
Thank you, Governor. Dr. Byers, this question is for you, if I may. So when I've been talking to some people, they say when they get their first dose, they get a date time frame on where to go for this, on when to go get the second dose, but that's just about it. Now, MSDH tweeted out, like you guys had mentioned earlier, the Mississippi State Department of Health is announced that you can now make a second dose appointment for sites throughout the state immediately after receiving your first dose. Can you dive in more on how this works when you go to covidvaccine.umc.edu, please?
Yeah, absolutely. And so we encourage folks to go ahead and do that because we do have those appointments opened up now. So if I got a vaccine yesterday at one of our drive-thrus, you go on to the website, just like you're doing the scheduler for the first dose, but this time you select second dose. And it asks you the kind of vaccine that you've been given the first dose, the Pfizer or the Moderna. And once you select that, and you are also prompted to say the date that you received it. And once you've done those two things, you've designated the vaccine you got for the first dose and the vaccine you got, the date you got it, then you will receive and you'll be able to see the appointments available at the locations for that vaccine and at the appropriate time frame. So the time frame is already built in. So once you say that you got your vaccine on January 28th, the appointments that are 4 weeks from that, if it was Moderna, show up and after. And so you just select your appointment location and your time and you make the appointment.
So anyone who got a vaccine like a week ago and had yet to register because they thought nothing was open, there's now something open for anyone who's already first dose vaccinated?
That's true.
So starting on Monday, you were able to get your vaccine and immediately go forward and scheduled your second vaccine. As of this afternoon, if you had gotten your first dose last week or the week before, you can now go to the appropriate week or appropriate day and schedule it. Now, in a perfect world, everybody, from a simplicity of logistics standpoint, everybody would go back to the same spot that they got their first dose. Because we know we had 30,000 first doses 3 weeks prior, we'll have 30,000 second doses. But that's not going to happen. We know that. There are some people who drove a long way to get their first dose, and they can get an appointment somewhere closer. And that's fine. That's certainly allowable and acceptable. But just know there are going to be the same number of appointments available at roughly the same places, but there are going to be some people that may have to, some people are going to choose to go to a different spot. Some people may have to go to a different spot because those second dose appointments fill up. And so, again, we hope that's somewhat marginal. The easiest thing, again, is for everybody to go to the same spot exactly 3 weeks or exactly 4 weeks later. But the logistics is going to be a little bit more difficult. Where we're going to get to, this week we're doing 30,000 first dose appointments at our state-run sites. Next week we're going to do 30,000 first dose appointments and approximately 17,000 second dose appointments at those same sites. The week following that, we're going to do approximately 30,000 first dose shots and 30,000 second dose shots. So that's the week of February 8th. So we've got to make sure we have adequate resources at these sites to basically double the total number of vaccinations that are done. And that's where we're working with Colonel Parker at the Mississippi National Guard and MEMA and Department of Health to make sure that those resources are there. Because the one thing that I've heard repeatedly throughout this process is the state-run sites are running very, very smoothly. People are very pleased with the way in which they've been able to get in and out. Understand it's going to be a little bit more challenging because we're doubling the number of appointments because we're doing first dose and second dose appointments simultaneously at the same sites. And so, again, that's logistically, we think, the best approach. We have been willing to change course if it ever becomes necessary, and we'll continue to do, but we think we can do that, and we think we have the personnel available to do it. Yes, ma'am.
This is a question for Governor Reeves or Dr. Byers. So you all have talked about some of the equity issues in the state before, but we are seeing that some predominantly Black communities haven't had some of these state-run vaccination sites. For example, Hinds County just got one last week. why did it take so long for this predominantly black community to get a site? And of course, we're seeing in the Delta as well, where there are majority black communities, there are no vaccination sites. Why is it taking so long to get them there, and what are you going to do about it?
So we're working on both of those things, and certainly we're pleased to have a site in Hinds County now, and we're certainly excited to have it expanded to more days. And a lot of it was logistics. You need to understand that we're running these testing sites as well in all 82 counties with the same personnel. And so we already have a very large testing site in Hinds County, and it took us a little bit of time to get it logistically set up to make sure that we had a Hinds County site. But we were always planning to do that, and we're glad that we have one now. We are actively looking at additional counties to expand partnerships in, either through providing vaccine to those external partners for them to be able to directly administer those vaccines to those vulnerable populations. And we have already started doing some of that with the vaccine that we've distributed, especially to our FQHCs, to help, you know, and you know, we've published our data, and we know that right now only about 16% of our vaccinations have been among African Americans. The reason we publish that data is for awareness, and to shine a light on it. But we also need to address it, and that's one of the things that we're working on now.
As a follow-up to that, you mentioned the 16% figure. Obviously, that probably has to do more with healthcare workers. What plans are there on the part of the state to do outreach efforts for healthcare workers that go beyond just having, you know, black healthcare workers and doctors showing that they're getting the vaccination publicly?
Yeah, so one of the things that we're going to do is continue to work with those communities. We actually had a meeting yesterday, and we plan on actually working to get the vaccine out more to those communities, to those healthcare workers, not just to the healthcare workers, but to any person of color who's in those eligibility categories. And so we're working to establish more localized clinics to administer the vaccine to those individuals.
Yep. Okay. This is a numbers question. So I know that you had mentioned that we're going to be doing 30,000 second doses, but there's close to 200,000 people who've gotten their first dose, right? And at a rate of 30,000 per week, how is it going to be possible to catch up with the second doses?
Well, actually, we are doing 30,000 second doses the week of February 8th at our state-run sites. And if you'll recall, each week we have a maximum of 30,000 first doses. And so the 30,000 doses that we are doing the week of February the 8th will perfectly coincide with the number of people who are eligible to get their second dose that received their first dose from the state-run sites. Now, keep in mind there are, and this is one thing I want to make sure that everyone's clear, there are approximately 170 partners situated in virtually every single county throughout the state that have received vaccine, that have done first doses, and many of them have now done second doses. Just to give you an idea, we have currently done 21,941 second doses. We have not done any second doses at our state-run sites. So that's our partners, that many of whom received vaccines early in the first 3 weeks, and therefore there are people who are eligible for their second dose. And so I want to be clear that there is vaccines available that have been shipped to virtually every single county throughout the state. I presume, I can't tell you every county, but a large majority. For instance, because I did the numbers, because you know, one of the things that that needs to be stated with respect to the number of African Americans that have received it. In our total vaccine distribution, this is one of the things that Dr. Dobbs and Dr. Byers and I continually try to improve upon the data. You know, right now we have approximately 22,565 individuals who have received their first dose that are listed as other. They're not listed as white or African American in the data. And so we're trying to improve data collection so that we have a better, more accurate viewpoint. You've heard me talk about this before, because when you talk in context of only 17% of the total doses have gone to African Americans, another way to look at that is right now 69% of total doses have gone to Caucasian Mississippians. Well, that's about where it should be. We just don't know exactly what that other 16%, who falls into that category. My guess is there's some of both. But also, the other way to look at it is geographically, because I know you mentioned the state-run site. There are state-run sites in the Mississippi Delta. And if you look at total number of doses given, for instance, in Bolivar and Washington County combined, there's a little over 5,000 doses have been delivered in Bolivar and Washington County. And if you do the math, the total distribution in Bolivar and Washington County is just barely slightly below their total population, the population is the total percentage of Mississippi. So yeah, the distribution from a county by county basis is actually fairly close to where the population runs. What we need is more vaccine. We need more vaccine manufactured in this country. We need more individuals that will, we need more individual companies that have a vaccination that is approved. We know that AstraZeneca, for instance, maybe J&J or both, at or near that point at which they ask for an emergency use authorization, hopefully in the next couple of weeks. And that'll go a long way towards helping us. In fact, I was happy to see that not long after I commented on it, that the Biden administration recognized just in the last couple of days that their initial goal of 100 million doses in 100 days was way too low, and they actually raised it by 50%, I think, over the last 24 hours or so. Now they're saying they want to do 150 million doses within the first 100 days. We need to keep raising the level of expectations and keep measuring that because we have the capacity to deliver them now in Mississippi. We just need vaccines.
A quick follow-up to that before I ask Dr. Byers. When we bump up to the 43,000 allocation, will the split still be about the same? I know now we've got the 30,000 to the state-run, 7,000 to the partners. Do you anticipate a similar split even when the allocation ups?
Well, what I would expect, at least initially, because keep in mind, we don't want to, we have to increase capacity at our state, we have to double the capacity at our state-run sites over the next 9 days. And so we went from 0 to 30,000 over about a 9-day period. Now we're going from 30,000 this week to 60,000 2 weeks from now. We are confident that we can do that, but we don't want to increase the number of variables out there that reduce the likelihood that we can get that done. And so what I would anticipate, and I will tell you that Dr. Dobbs and I and Dr. Byers and I have not sat down and had this conversation, but what I would anticipate, at least initially, is that the 30,000 go to the state-run sites. The 6,000 or 7,000 that have been going to our partners would basically, we would move that from 6,000 or 7,000 up to the full 13,000 that are left, is what I expect. I'll also tell you that we are working very hard with the federal pharmacy program, and we're trying to get additional vaccines. We've been successful. We got 5,800 last week. I think we'll get another 5,800 this week to add on top of that. And so it may be that we're able to send as many as 20,000 total first doses to our partners. Now, I want to be clear, just like we have been since the beginning, if our partners are unsuccessful in getting them in arms the week that they receive them, they're not going to get more vaccine the next week. And so we want everybody to be on notice that, that we are getting more vaccine next week. We do plan to ship larger numbers out to our partners, and we hope and we expect that our partners will prepare now for that eventuality and work with us to be prepared to get those shots in arms. Because if we're getting roughly 20,000 additional, that gets us to almost 50,000 first doses next week. I'd like us to get 47,000, 48,000 of those in arms next week. So, but yeah, most of those additional ones will go to our community partners, either primarily to those clinics and hospitals that have shown a real willingness to put a plan together to get a lot of inoculations done. Because let's be clear, hospitals, clinics, nobody has just a whole lot of people sitting around not doing anything, okay? So it takes real effort in our local communities to make this work, but I think it's of such importance, and a lot of folks have bought into doing everything they can to get this in their communities done.
Dr. Byers, what is the update, if any, with the lab testing on whether or not we are seeing any variants? I know that we saw even today the South African strain detected in South Carolina. What are the concerns? What is the guidance for Mississippians who are hearing about this? Is it do more of the same or take some additional precautions?
So I'm glad you asked that. We do have ongoing surveillance looking for those variant strains, and we're actually working to expand that surveillance as well. You know, one of the things that we're doing is sending representative samples to CDC on a weekly basis to do some sequencing to determine if they are a variant strain. So far in Mississippi, we haven't identified any, which is good, but that doesn't necessarily mean that there aren't some in Mississippi. We need to continue to take those same precautions that we've been doing all along. You know, continue to wear a mask. When you have an opportunity, if you're eligible, get vaccinated. Continue to social distance. Continue to avoid those large gatherings. Those are all the kinds of things that we need to continue to do, whether we're seeing variant strains or not in Mississippi. I think that that's still going to be the best way to prevent transmission and prevent infection. And so we need to stay the course on that.
I'll give you a non-medical opinion. I don't know if we have these variant strains in Mississippi yet, but they're going to be here. Most likely, they're probably going to be everywhere. But the good news is, as we currently know the details, the game plan to deal with the variant strains is the same as the game plan to deal with the initial strain, which is, as Dr. Byers said, wear a mask, socially distance, get vaccinated as soon as you can possibly do so when you're eligible. Yes, sir.
Thank you, Governor. Dr. Byers, this question is for you, sir. To dive a little bit more into what we heard the governor touch up on some of, if you go to covidvaccine.umc.edu, it still says no available appointments right now for first doses. So is there a time frame and how much of first dose deliveries we could expect coming to Mississippi, when, and how would you distribute it versus state sites and private clinics you partner with?
So we're actively working on opening up additional first dose appointments on our scheduler right now. So the crew is working on that. We do have the doses available. We're getting an additional allocation. We get an allocation every week. And as the governor indicated, those allocations are going to be increasing a little bit, which will give us a little bit more flexibility to not only make sure that we continue to provide the vaccine that's needed to support the MSDH, National Guard, MEMA drive-through clinics, but also to give us a bit more flexibility to provide it to those external partners. And you know, it's a game where we're having to see what we get each week. Now we hope that visibility is going to improve instead of us waiting for a couple of days prior to Thursday to know what our allocation is. Once we get some greater visibility about knowing what we're going to get each week, and we've been assured that we are going to get that visibility, that's going to give us some greater latitude to have some planning so that we can not only make sure that we have the vaccine for the drive-through clinics, but that we can also select those external partners that are not only getting shots in arms, but are in those geographic locations where we know we need to increase vaccination.
So is it by Monday, you're saying the website might have first dose appointments again?
You know,
after each week?
I'll have to check on that. My suspicion is it's going to be by Monday, but it may be before then.
And how much each week again do we get in deliveries?
Right now, we've been getting about 37,000 first doses, but that's increasing. And as the governor said, that's going to be about 43,000 coming up. So that does give us a bit more flexibility. We don't know exactly what the allocation is for next week, but we anticipate that it's going to be about the same or maybe more. And, you know, each week we look at that, we look at our partners, and we determine where can we send that vaccine to, who is ready to be able to sit on go to give those shots in arms.
And I'll just reiterate, and I'll give you some numbers to justify. We are, for all intents and purposes, we have caught up. We have put virtually every first dose either in an arm or in an appointment that we have received. So as of today, we've received 224,000 first doses. We've inoculated through the end of yesterday 194,000. So that's about a 30,000 variant, right? We know we have 6,000 appointments scheduled at state-run sites today. We know we have 6,000 appointments scheduled at state-run sites tomorrow. So that takes that 30,000 variant down to about 18,000. We also know that there's a lag in reporting, which would represent probably 3,000 to 4,000 of those 18,000 that are left, would be my guesstimate, having looked at these numbers very closely every single day, which leaves about 13,000 or 14,000 first doses that are out there in the system. And what we know is that approximately 2/3 of those, or between a half and 2/3 of those, have been delivered to our partners within the last 48 to 72 hours. So my guess is they will continue to be put in arms yesterday, today, tomorrow, over the weekend. So we are basically caught up. There may be a 1 or 2% variant out there where maybe a facility in one county got 400 doses and have only done 150. So there's some of that out there. But at scale, we have accounted for 98 or 99% of our first doses, and we're just waiting on the feds to send us more. Yes.
Alex with Mississippi Today has a question.
Hey, thanks. We're just trying to get a little more clarity on the 100,000 a week goal. So I guess just a couple of parts to that. Is the goal to do that by the end of February? And is this based on a steady weekly allocation of 43,000 a week, or potentially an increase in that number?
Our goal is to have the capacity to do 100,000 shots per week. Now, that is dependent upon our ability to continue to see increases in first doses. Because long term, what we know is however many first doses we put in arms this week, combined in week 3 and week 4, we're going to put that many second doses in arms. So where we want to be able to get to is 50,000 first doses and 50,000 second doses simultaneously on a weekly basis being put in arms. For us to do 50,000 first doses, because as I just explained, we're basically done all that's out there, then we'll have to see another uptick in total number of first doses from the 43,000 that we're getting next week to an additional approximately 15% more to get to 50,000. And so, again, that's where we are. We think we will be able to do that. Keep in mind, in the second week of February, we're actually going to have more than 50,000, or in the second and third week of February, we'll have slightly more than 50,000 people eligible to get their second dose. Because if you look at our data, what you see is the week of January the 10th, we did 55,000 total shots. The week of January 17th, we did 62,615, and very few of that 117,000 were actual second doses. So those 2 weeks alone, we'll have approximately 100,000 people. Again, we're looking out in weeks 2 and 3 of February, 100,000 people that will be eligible for their second dose. But eventually, that'll all even out. We won't have a chart where we did, 32,000 the week of 1/3 and then 56,000. We'll start doing, again, 100% of all the first doses we get. And so over time, that should get us to an average of approximately 100,000 per week.
Kobe Vance with MTV has a question.
Yes, this question for just Dr. Byers. I saw that the Department of Health has a list on their website of 31 locations with hospitals and clinics throughout the state providing vaccines, but y'all mentioned that there's more than 170 partners throughout that process. Is this a full list of the hospitals that have vaccines to give right now, or can people still call their local clinic or hospital to see if they are performing vaccinations?
So that is a list of the most recent external partners who've received vaccine. We're updating that list, obviously, because we're going to be sending additional doses to more partners and to some of those same partners. So it is our intention to post a list on a weekly basis that demonstrates where individuals can call to get a vaccine that is outside of our drive-through clinic sites.
Dr. Byers, this question is for you, sir. When it comes to people recovering from COVID, a colleague of mine wanted to ask for some details. That some people are beginning to feel some side effects come back to them, whether it's whether they were hospitalized or not. So can you explain, is this something common? And if people are beginning to feel sick again, even after recovering from COVID, is it possible to catch it again? Should they be tested or call their doctor?
So, is it possible to get COVID again? It has been demonstrated in very rare occasions that individuals have been reinfected after an initial infection. We haven't seen that in Mississippi, but that has been reported out in several areas previously, that individuals who've been infected several months later may be reinfected. Typically what we think of is after a person is infected with COVID, that they are going to have immunity probably for at least 90 days to protect them against a reinfection. That certainly may be longer. And it may be even 6 months or more that an individual is protected. So do we see reinfections very commonly? No. Does it occur? Very rarely it can. As far as the long-term consequences of COVID, there has been a small population that have had some long-term illness that can be varied. It can be some difficulties with concentration. It can be increased fatigue. In some cases, it can be some long-term lung problems with shortness of breath. And so there has been a defined group and some defined long COVID that does occur. Now, if an individual has been previously infected with COVID and are now having signs and symptoms of what looks like a new acute infection, that is, if they're suddenly having onset of fever, cough, shortness of breath, those same kinds of symptoms that we would think of with a new infection of COVID, we do recommend that they see their doctor, and their doctor can make a decision about whether or not they would need to be retested for COVID.
A quick follow-up, if I may. When it comes to second doses, some people are also having side effects from a second round of vaccine, apparently. Elderly people having respiratory issues or having to be hospitalized from it. I don't know if this is specifically in Mississippi, but have you seen any of this in your study or know about it?
No, we have not. We've certainly seen people who, after their second dose, have had some more symptoms of sometimes fatigue, muscle pain, tiredness, in some cases fever, in some cases some arm soreness that's more pronounced than they had with the first dose of vaccine. We haven't seen anybody who's had significant respiratory problems that have required them to go to the hospital. And actually, when you look at the safety data for individuals who are older, they typically have less of those kinds of symptoms from the vaccine than the younger population does.
Courtney?
Colonel Michelle, just wanted to see kind of how your own experience with COVID-19 kind of impacted these last few months for you, and also kind of the decision to step away. And I know Governor mentioned that you'll have this conversation for a few months, so trying to find a time that seemed right in the midst of vaccine rollout, your own experience with COVID, all of these different variables. Yeah,
so I'll start with your first question, the COVID. My experience with COVID was very unexpected. I fully, I try to do my best, try to stay healthy. It's a very fast-paced occupation, so I've always tried to do that. So when I was tested positive, I felt very confident that I would get through it pretty quickly, but I found out after about 5, 6, 7 days, and that COVID does not care how healthy you are. The doctors explained to me that my viral load was very heavy, which is the reason why that it resulted in the to the degree that it did and being hospitalized. The pneumonia was the biggest piece. And anything time you go through like that, the reflection period, you look at things and you don't really fully appreciate a breath of fresh air until you cannot get it. So it has changed my way of looking into COVID, and it made me tighten up my measures a lot more when I'm out and about in the public with being cautious. With regard to the timing of leaving this job, you know, I will tell you that, as you have indicated, and the governor will attest to this, there's been no gap. There's been no gap to do it, but we talked very well back about it, and we wanted to make sure that we had a good, long enough transition time, you know, to do that. And of course, my COVID even, you know, extended that a little bit more because we weren't able to do it. But you know, there's no reason. The governor and I have a wonderful relationship. I've gotten to know him a lot over the course of the period. I did not know him coming in, which was quite different than with my previous term. But I've really gotten to know him, and he's worked extremely hard, and his heart is in it. And he's got a really tough task, but I've really enjoyed working with him. So it's a bittersweet day. You know, in a lot of ways, I'm going to miss this, if you can, if you can say that. But I think the timing, you know, just timing is good. And like I say, Mac and I have been doing a transition for about 3 years now. So he's going to walk right in, and it's going to be full throttle and never miss a beat.
Dr. Byers, you guys have talked about how African Americans prefer to go to places they know, right? Private clinics, their physician. But when we look at the weekly allocation to private partners, it's around 6,000 doses. Each county, you guys said, was about 79 doses per county about a week ago. Does that have any correlation with the disparity in African Americans receiving vaccines?
Certainly it might. We know that there's a couple of things that could be happening, certainly hesitancy, but also are we putting the vaccine in a place where African Americans can easily get to it? And so those are the things that we're working on now. And you know, you mentioned the 6,000 or so doses that we sent out to external partners. We're trying to do that in a mindful way to make sure that we do maximize our abilities to have it available for African Americans. Certainly more doses in the coming few weeks are gonna help with that, and we're gonna continue that effort, but that's a great point. Yes, sir.
And a follow-up to that 43,000 Governor Reeves mentioned, that could go up to 13,000 for private partners. If the data doesn't change, will you guys change your approach, or with more doses, what do you guys think is going to happen with that?
Well, if the data doesn't change, certainly we're in a continuum of change and changing approach right now, and we're actually looking at some additional data to help guide where we put those vaccines. Not only what is the percent of individuals who are being vaccinated who are eligible at a county level by race, but also who are the people that are vulnerable in that county? Where are the gaps? Where are we missing it? And where do we need to put that vaccine? And we're currently working on that, but those are all great points.
Thank you. Director Mack, this question is for you, if I may. First off, congratulations and welcome to the new spotlight. I guess to sort of back off with what former director now Michelle was saying, when people see a change in leadership, sometimes things might also change with the actions of the department. In what ways can you ensure the Mississippians that MEMA's involvement is not going to slow down? There's not going to be a lot of drastic changes that you're prepared to immediately dive into, and perhaps, I mean, one of the biggest things that any new director will have to inherit.
Yeah, thank you for the question. There's a thing you do when you respond to disasters. It's an all hazard. It's a new disaster every time. I never thought I'd deploy to a C-130 falling out of the sky. Never thought I would be, as an Army and Air Force soldier and airman, be out on the waters in the Gulf doing the oil spill response. So there is something you prepare for, and the teams that I have been with is all hazard response. And sitting here during this press conference, Hootie Adams, the EM director for Hancock County, we're all kind of chuckling. Hootie's a good friend of mine because I met him during Katrina, and we worked hand in hand. Jackson County flew a lot of miles with Earl Etheridge in the air. So these directors and responders, I started out at the local level in a city. I went to a county. I went to the state. I worked for the federal government response. Now I'm back at the state, and hopefully not soon I'll go back to a county. I'm hoping I can continue this state job for a long time. So those relationships are there. And I've been the one out there on the front line with them. I've been the state coordinating officer in almost every disaster up until the last 2 years, and I've trained and passed that on to Todd DeMuth and others in the agency. So we're trained 2 to 3 deep at MEMA to do every job, and that's because this guy, when he came in, he said, you got to have a number 2. And I want a number 3, and we work diligently to do that in every position, so when one goes down, next man up, next woman up, next person up. That's what we've been prepared for. Been out there in the field, and I love all the guys and gals that are serving out there in emergency management agencies at the local level, because that's where I was, and I know how important that is. I know how difficult it is, and our job is to support them with training and anything they need in response. That's what we do. So there's not going to be a miss and a glitch. I've got a high bar. But I guarantee you we're going to do it. And it's not because Steve McCraney's sitting in the seat. It's because of the employees at MEMA. The person that flips the switch, that is the most important person in my agency. And those are all over the state, deployed every day. And they're doing a great job. And we're going to continue to support them and do that.
Mr. Michelle, a quick follow-up for you, if I may. What's the next move for you? Are you going into the private sector, or is this a full-time retirement to spend time with family? What's next for you?
I would like to think that it'll be full-time, and hopefully it will be. It'll just have to see how much money my daughter continues to cost me going to college. No, I'm just going to be still right now, to be quite honest with you. I think it's important that I've been working a real high-paced job, and even coming out of the military, it was high-paced. So I'm going to be still for a little bit, and then I'll figure it out, and eventually, can't ever tell where I may pop back up. But right now, I just want to be still.
Let me just say something, because I think it's important. I don't know that all of my fellow Mississippians fully understand and appreciate how lucky and fortunate we are to have 2 things. Number one, the emergency management team that we have in Mississippi, that every county in Mississippi has an emergency, someone responsible for emergency management. We take that for granted because we expect it. We have to have it, by the way, because we had 11 federally declared disasters in 2020, and we have a great team at MEMA, but without our local partners, it would have been so much more difficult. But we take that for granted because there are a lot of states where that's just not the case. They're not prepared like we were, and in fact, even through COVID, we knew so well how to deal with FEMA and the things that they require, whereas a lot of states that maybe don't typically get tornadoes and hurricanes and things such as that really struggled early on to try to figure out exactly how do we coordinate with our FEMA resources. And then the second piece, where we are so very, very fortunate, it's the reason you see me try to say thank you as often as I can, is the men and women of the Mississippi National Guard. Mississippi's response to COVID, our Guards, men and women, have been number 1 in the country in terms of total number of folks, the vaccine distribution. They are our partners in the emergency management role. They're our partners with the State Department of Health, but they are just doing phenomenal work. And we are fortunate as a state that we have the ability to do. We have almost 1,600 of them on active duty right now, helping us with this response. And they are the reason that we have gone from 50th in vaccine distribution to, quite frankly, in the mid-20s, is because the efficiency with which they run the operations, partnering with the State Department of Health, is incredible. And I'd love for y'all to talk to someone who goes through, y'all may have done this and I just hadn't seen it, but talk to an individual that has gone through the line. And I will tell you, when my own mom did it sometime late last week, she said it took her about 18 minutes. 3 minutes to go through the line and get the shot, and 15 minutes that Dr. Byers requires everybody to stay and make sure that they're safe and comfortable and okay. They're just running a heck of an efficient operation. Now, we know we're doubling the number of vaccines at each of these sites 2 weeks from now, and that's going to, we got work to do logistically, but they have just done fantastic work. And, I mean, obviously, these 2 gentlemen to my right have experience on both sides of that equation at the local emergency management level as well as at the Guard. But the partnerships that we have in place, you know, there's a lot of noise out there always, and a lot of people find reasons to complain, but what's going on with our emergency management, our State Department of Health, and our Mississippi National Guard is something that we all as Mississippians can be proud of.